Welcome back. If you're joining us for the first time, my name is Dr. Ivy Branin. I'm a naturopathic doctor specializing in women's health and hormones in New York City. And if you have not yet subscribed to our YouTube channel, shame on you. Definitely want to subscribe because I'd hate for you to miss out on all the great content that we're putting out. And if you like this video, don't be shy, definitely like it, and also don't even feel embarrassed or ashamed or whatever you'd like to put in the comment chat. I'm more than happy to answer any questions that you might have regarding today's topic. So I've been kind of slow, I have to admit, to putting out these videos. I'm now, my son is now 7, almost 8 months old, and I was hoping to put in a lot more of my postpartum series, but it's a little bit slower because of shift in priority. So please bear with me. Thank you. And today I wanted to talk all about a topic that a lot of people don't realize is it actually is the number one complication of pregnancy, which is postpartum depression. And this was definitely something I was very concerned about when I became pregnant. One, because I've worked with a lot of patients with postpartum depression and even postpartum psychosis. And that was something that I was very concerned that might happen to me, because it can really happen to anyone. In fact, actually, one of the things that really inspired today's video was a question, and basically from a potential patient around having had postpartum depression with the first pregnancy, whether there was anything that could be done to prevent postpartum in this second pregnancy. So let's first start off with what exactly is postpartum depression. So the baby blues, which is characteristic of low mood swings, crying from out of nowhere, sleep disturbances, these are pretty standard across the board for most people who have given birth. And typically these types of symptoms start within the first few days after giving birth, and could persist for a week or more. Mostly this is due to the hormonal changes that happen after giving birth. Basically, all the hormones decrease quite rapidly. Also changes in sleep, because of the hormone changes, but also taking care of a newborn whose sleep schedule might not really coincide with your regular sleep schedule. So that's more like baby blues. So the big differentiator between the baby blues and postpartum depression is really the intensity and the duration of the depressive symptoms. Another just interesting thing to note about postpartum depression, it's also not uncommon for postpartum depression symptoms to start much later after giving birth. So it's not something that always happens immediately after, or that like week or so after. So it's kind of like the main differentiator. And then when we talk about something like postpartum psychosis, we're talking about, again, even more extreme, longer duration of symptoms. So what are some of the main symptoms of postpartum depression? So definitely anything that the classic symptoms of depression, of lack of motivation, lack of interest in things, sleep disturbances, both insomnia or sleeping too much, crying out of nowhere, feeling withdrawn from friends, from family, changes in appetite, whether it's lack of appetite, overeating, doubt. So this probably is very I would say very common with all new moms. I know I have this fear around being a good enough mom, hopelessness, suicidal ideation, though not required, but can definitely happen with postpartum depression, periods of anxiety, panic attacks, thoughts of, besides suicidal ideation, thoughts of harming yourself or oneself, or even the baby. And this is definitely something that we would look at when it comes to postpartum psychosis, restlessness, agitation, a lot of distress. And again, the big differentiator, it's not uncommon to have difficulty with mood and sleep, etc., for a whole bunch of different reasons after giving birth, but it's more about how long this is happening and also the intensity. And it's really important, if you are experiencing these symptoms, that you don't keep them to yourself. Very, very important. So what is the treatment for postpartum depression? And I would say in general, across the board, would be really the best way specifically to prevent postpartum depression is looking at pregnancy and what we're doing during pregnancy. And I'm not just talking about nutrition, but also nutrition, exercise, developing mindfulness techniques, and even starting out with coming up with a plan of what you hopefully envision after you've given birth, who's going to be your support team, both emotionally, but also, people who's going to clean for you, who's going to be cooking for you. So really getting a lot of these kinds of things in place during pregnancy can really, really help. Along the line specifically of eating well during pregnancy, making sure, and you can watch my video on an optimal pregnancy and the supplements I recommend, but again, definitely making sure that you're on a good quality multivitamin, vitamin D, your omegas, and some other nutrients as well. Again, that you can definitely check in and watch the actually a lot of those tips in the pregnancy video are really good for preventing postpartum depression. The other kind of key factor, at least as a naturopath and like what I'm looking for, is ruling out other things that can mimic postpartum depression. So for example, hypothyroidism. Hypothyroidism is very common during pregnancy and also after pregnancy. One of my little jokes is that babies are like the ultimate like vitamin nutrient vampire, and if our certain key nutrients go down, that actually has a negative impact on thyroid function, and so that can actually mimic depression. Also kind of similarly, anemia also can be a factor in depressive symptoms. The other thing too, if you already have a history of depression, you're more likely to have postpartum depression. And I would say that, if you are on medication, which is fine, that you also consult with a reproductive psychiatrist or psychopharmacologist, both during pregnancy and after birth, because some medications, again, depending if you are choosing to breastfeed, that is like definitely going to be a big factor. So then once you've given birth, some, again, like proper nutrition and hydration. If you want to learn more about some of those tips, I highly recommend you watch my lactation video, because most of those nutritional recommendations would be the same. And that's, again, why it's important to have a plan before you give birth of where this food is going to be coming from, who are you enlisting to nourish yourself. Physical exercise, obviously depending on what kind of birth that you have, will determine the level of activity. I mean, I actually ended up having a C-section, so it took me a few weeks before I was in a very slow process, but definitely doing some physical movement, specifically getting outside, whether, again, you're just pushing your baby outside. I know that for myself, like, that really helped, and also like meeting up with the other new moms and going on walks with them. Also, there's a lot of, well, again, I'm just talking about New York City. In New York City, we have, Baby and Me yoga. I was taking that at the prenatal yoga studio. So there's a lot of ways of getting in the exercise. meditation and yoga in general, so any kind of like mindfulness technique. And again, this could be really good to, again, like start during pregnancy and then continuing after pregnancy to prevent depression. Having a great support system, again, for your emotional needs, but also like that extra set of hands, whether it's a cleaner, whether it's, again, somebody cooking for you, doulas. So yes, we think of doulas definitely in the birthing process, but many doulas now also offer postpartum services. So having a doula can be very, very helpful. And then interestingly enough, that there's actually an increase in postpartum depression in women who actually end up birthing in the winter months. So I actually see a 30% increase. So doing something like light therapy, for example, where you're using full spectrum lighting, and you don't need to necessarily like invest in like a big fancy light box, but you can actually just get full spectrum light bulbs at any hardware store. It doesn't even have to be like some kind of fancy health food store, and you can just replace all the lights in your home with the full spectrum lighting. So those are some of the main things that I think of when it comes to postpartum depression. And then what are some of the natural remedies that I often prescribe for postpartum depression? Now, the big thing, so everything I'm recommending are things that are safe during lactation. There are other things that I would also recommend, but just to cover the basis of, again, for most patients that might be lactating or breastfeeding, that I wanted to prescribe or recommend things that you could take during lactation. So first, definitely being like a high quality multivitamin, one with methylated B vitamins, chromium, zinc, iodine. Iodine's huge, both like during pregnancy and after pregnancy for thyroid function. The one that I typically recommend is BEM1. I love that. It's the one a day. I love it. It has everything you need. Omega, specifically DHA. And again, back to like the whole nutrient vampires. So our babies need a lot of DHA, and DHA is one of the omega-3s. It's really good for mood support. The fish oil that I recommend is by Nordic Naturals. I really like their Pro Omega 2000D. Typically, I usually will dose that at 2 caps because you get both omegas, but you also get vitamin D. Now, you might still need some additional vitamin D, specifically, again, if you are lactating, or also if you already know that you have low vitamin D. So I typically will recommend most people to be doing anywhere 2,000 to 4,000 IUs of vitamin D a day. Magnesium. So magnesium is really important for mood regulation, and also really helps with sleep. And again, sleep can greatly impact mood and can worsen the symptoms of postpartum depression. So taking magnesium before bed can really help. It also can help with regularity. The magnesium that I like, just because of it has 3 different forms, is by Vital Nutrients. I really like their triple magnesium for this purpose. Now I'm going to get into some more specialized supplements that are much more geared for more severe forms of more of a classic postpartum depression. So NAC, N-acetylcysteine, I like that, mostly specifically if there is sort of like this repetitive thoughts, can be really helpful, dosed anywhere from 600 to 1,800 milligrams per day. Tyrosine. So tyrosine is an amino acid and serves a couple purposes. One, it actually does support thyroid function, but it also is the basis of some of our neurotransmitters that could be off and associated with postpartum depression, things like norepinephrine and epinephrine, and also dopamine. So I usually will prescribe possibly tyrosine. A classic one that some of you might already know about is 5-HTP. So 5-HTP is the second step of Tryptophan, it is a precursor of serotonin, also precursor of melatonin as well. So it can definitely help with sleep. So often so tyrosine's a little bit more of an upper kind of feeling, and 5-HTP is a little bit more of a lower type of feeling, I guess you would say. And so often I might be more inclined to dose 5-HTP at night. The other thing is that you always want to make sure that you are getting B6. And so if you're taking the Fem1, you're getting the B6. And so they work really well together, and that helps to make sure that it crosses the blood-brain barrier. Another one that specifically when it comes to not necessarily sleep onset, but sleep maintenance would be phosphatidylserine. I like to dose that at night, and that helps with cortisol levels. And so sometimes cortisol can be off again due to the stress of pregnancy. And then lastly, another supplement that I really like for postpartum depression is inositol. Again, I like to dose that at night, and it has some similar actions to the N-acetylcysteine, so really helping with a lot of the more like the repetitive thoughts. And if you want to, you're like, okay, there's a lot of supplements, where do I get them? I highly recommend that you create an account with my full script, and with your first order you get 10% off, and you can find access to all the best professional brands, and you can find the choice brands that I like with all of those, and you can get everything right there on full script. And I'll make sure to definitely include a link to the full script in the description of this video. So lastly, I just wanted to talk a little bit about support around postpartum depression. So definitely in conjunction with whether you choose a natural route or a pharmaceutical route, having either a licensed psychotherapist or social worker, someone, or even some support group can be very helpful. One in particular, there is a Postpartum Support International's helpline. They also have a website. I'll leave the number also in the description, but I'll also say it right here, is 1-800-944-4773. So again, like if you're feeling overwhelmed, if you're feeling at a loss, you're like, why shouldn't I be happier? Isn't this what I've always wanted? I've always wanted to be a mom. Don't forget, please speak out. Make sure that you contact someone, and that helpline I think would really help. So that was a lot of information, and I hopefully you found it helpful. Again, my name is Dr. Ivy Branin. If you have not yet subscribed to our YouTube channel, definitely subscribe. Also, don't forget, if you did like the video, don't be shy, like the video, and also happy to answer any questions that you might have that you can leave in the comment section. And we're going to also make sure to include all those things I was talking about in the description, so you can always create an account with our full script. And yeah, so hopefully I'll see you soon, and I'm looking forward to talking a lot more about postpartum. Have a great day.